Let's start with that final point. It's great news that the adults will have been offered their first jab by July the 31st. Does it mean we could have a summer holiday?
Well, you'll hear more from the Prime Minister on that tomorrow. He'll set out a roadmap that gives the direction, and we've been clear that it will be cautious yet irreversible. The goal is that we take each step in turn, and we don't have to go back. And obviously, in doing that, we'll follow the data and we'll look very, very carefully all the way through at the impact of what we're all collectively doing on making sure that we can keep the NHS safe and keep the number of deaths down.
Would you prefer people to wait until they've had that second dose to say they've been vaccinated? Would that
Well,
help?
yes, it does. It does. We think that the first vaccine gives you a significant degree of protection, but there's no doubt that the second vaccine is important as well. So people do need to follow the rules now. I mean, it's there's still almost 20,000 people in hospital. So one of the challenges is that at the moment we need people to be following the rules, to be getting those cases down, to be protecting each other by following the social distancing rules, whilst of course we do the vaccination program. So that is a part of the challenge. We've now vaccinated 1 in 3 of all adults in the country, but that's the first dose, and there's still a lot to go.
But would you say, look, don't relax, don't bend the
Yeah.
rules, don't do anything until that second jab has been administered, has gone into your arm?
Well, I'd say more than that, which is follow the rules as we relax them, because the point about the vaccination program is, yes, it protects you, but it also is about protecting everybody and keeping this whole thing under control. So that's why it's so important that even though people might have received their first jab, a small number of people, a handful, have received their second, we've still all got to follow the rules together and do this collectively, because it's a collective problem, a pandemic, by its nature.
And data, not dates. That's your mantra. Does that mean that tomorrow, the date for schools reopening is really the only firm date we can get?
Well, you'll see how the Prime Minister is going to set this out tomorrow. The vigilance on the data is important, but at the same time, we want to set a direction of travel, and that's the challenge, and that's what the Prime Minister will do tomorrow.
But each time a restriction is lifted, so we're pretty confident that schools are the nation's priority, are your priority, so that will be the first one. Do we have to pause as a nation, find out what impact that particular easing has before we even think about the next easing?
Well, we do have to watch and see the impact of each step, and see that in the data, and be vigilant, because it's all about protecting people. I mean, that's why all these rules are in place. Nobody wants these rules, but they're in place in order to protect people. So in a way, the answer is obviously that we've got to follow these and watch these data like a hawk. But at the same time, we do want to give people a sense of direction. I think pulling off that balance is the challenge.
How long does it take to get the data? So, for example, let's say, for example, all pupils are back at school on the 8th of March, or certainly
Yeah,
some. Then how
yeah.
long do we have to wait to say, oh, right, that's the impact of that easing? Is it days? Is it weeks? How long is it?
We think that it's a few weeks. We think that you can start, if you think about it, if you lift a measure and there's more social contact, it takes typically about a week for people to become symptomatic. It then takes another couple of weeks to be able to see the effect of that, because it's not just one person passing to another. It's if that chain continues. So it is a few weeks. Hence, there'll be a few weeks between the steps, so that we can watch carefully.
Could you talk us through the logistics of testing for school pupils? What's in place for when they do return, or is that still work in progress?
That'll all be set out. The Education Secretary is working incredibly hard on it. But the process, one of the things that we're going to spend the next 2 weeks on, because we've said that there'll be 2 weeks between any announcement and schools going back. One of the things that we would spend that time on is making sure that we get all this set up. The good news is that all schools already have testing in place because they're open, all secondary schools, that is, and so the testing systems are already up and running. But obviously, if schools come back, then the scale of that needs to be much bigger, and it's an important piece of work. But we want to make sure everybody knows how to get tested, and then we test people in a way that not only limits the spread of the disease and spots people if they're positive, but also limits the impact, the spread of the disease from school children, who we know are very, very unlikely to be badly affected, even if they catch COVID, and to limit the spread from school children to their loved ones and their families as well. So it's about protecting everybody and stopping the spread, whilst also obviously keeping getting kids back to school, because that's so important.
And the infection rate is, of course, crucial and controlling that. The World Health Organization says that coronavirus recedes to manageable levels when cases fall below 50 per 100,000. Is that useful to us? Is that a useful figure to look at, for us all to look at?
Well, I'd obviously rather cases were below 50 per 100,000 than above 50 per 100,000 as they are now. But, the thing is, the lower the case numbers, obviously, the easier it is to handle. There isn't a sort of definitive cutoff. The virus itself doesn't recognize sort of, numerical boundaries like that. But it's definitely true that the fewer cases you have, the easier it is to use a testing and tracing system. We thankfully have now a massive testing capability in this country. Both the classic tests that go off to a lab, so-called PCR tests, and the ones that give you a result within a few minutes, the lateral flow devices, and the genomic sequencing, which is important for spotting new variants. So we're now well placed with that system. Clearly, the fewer cases, the more effective that system is, but there isn't a sort of numerical cutoff like that.
But social distancing and masks will be part of our lives for some time to come until we get those cases really down.
Well, yeah, and I think that, a lot of this is about how people behave, right? In fact, all of it is about how people behave. And so it isn't just about government decisions, it's about how all of us act and are respectful about social distancing. That's on us all.
For a while.
Well, yes, I imagine so, but I want to see it more about personal responsibility over time, as we've vaccinated more and more of the population.
Looking at the numbers, the COVID infection numbers, it's clear that there's big regional and local variation, just as there was last year. If you look at the ones at the top of the league table, you're sort of looking at Corby, Middlesbrough, Ashfield, Sandwell, St Helens, Leicester. They're around 300 per 100,000 mark. Some areas, they're not that high, but they are seeing rising infection rates. Boston, Tameside, Redcar, Doncaster. Now, I'm not an expert like you are, Matt Hancock, but these areas suggest to me that they may have something in common. They may include a lot of low-paid work, and that's a problem when it comes to getting that infection rate down. What can we do? The strict lockdown in those areas isn't enough.
Well, we have got a challenge, and we've had it throughout, of differential rates of infection. Actually, the differences are lower than they have been in the past, and so we think that Well, and the other thing that is interesting, based on your question, which is there are some areas that are very similar demographically that have got very, very different rates of infection. So whilst there are some places where the infection isn't coming down as fast as in others. There's very similar places where it's coming down very quickly. So, what matters is the local action to try to put in the testing, to make sure that we give people the support that they need, and we make sure that people have the financial support they need through the £500 payment if we require somebody to isolate. So, getting that all delivered in a uniform way on the ground is a challenge. We work very closely with local authorities to do it. But overall, I'd say that the rate is coming down broadly across the country, and the rates are not the gaps in the rates, if you like, are not as big as they have been earlier in the pandemic.
Does it worry you that most of the applications for the £500 sum that you mentioned are turned down?
Well, I want to make sure that the applications are accepted where they're necessary, but there are those rules in place for who's eligible, and it's right that the eligibility is checked. So, what matters is not the overall proportion that are turned down. What matters is that the right people are getting it, and that's what I check. And we obviously it's a constant piece of work to make sure that people get the support that they need.
Now, I know you're not going to. I can't tempt you when it comes to summer holidays, but the benchmark for travel corridors was 20 per 100,000 last year.
Mm.
Do you still consider that a useful benchmark?
Well, at the moment, we have a much firmer policy in place, not least because this isn't just about the so-called wild type, the original virus. It's also about the new variants and protecting against new variants. Hence the hotel quarantine for people coming from the at-risk parts of the world. So we do have a tough approach at the borders. I know I've been criticised for it being too tough, but I think that it's important that we have a tough approach to protect the vaccine rollout here.
Of course, you're responsible for our NHS, and you will know how many people are now waiting over a year for an operation or treatment. It's 224,000. A year ago, it was 1,600.
Yeah.
How will you bring those waiting lists down? When will it be
Yes.
back to 1,600?
Well, I hope it'll go back below 1,600 because before the pandemic, we were on track to get it to zero, which is where I'd like to see it. The number of people waiting over 12 months. It has gone up inevitably as a consequence of the pandemic. We've been putting more money into the NHS to make sure that they can not just deal with the pandemic, but also deal with this backlog. Obviously, a lot of that had to be paused during this second peak. And it's critical that the staff in the NHS get some R&R as well, because they've had a really tough winter so far. There's still almost 20,000 people in hospital with COVID. But then we are going to have to absolutely get through this backlog. So that's a big part of the agenda for the rest of 2021. It's another reason to be cautious on the steps out of lockdown, so that the NHS can get back to making sure people get prompt treatment.
Mr. Hancock, good morning. It's Tom here.
Good morning.
A couple of quick questions on coronavirus and then one other if I can. The Israeli Health Ministry reported some fascinating statistics yesterday, which I'm sure you saw. The Pfizer vaccine prevents 98.9% of COVID deaths, 99.2% against people getting serious illness, which is obviously great numbers. But it still does leave 1 in 100 of people who've taken the vaccine susceptible to both serious illness and death. Of course, as well as all those who haven't taken the vaccine, they've refused it, and we don't know how much that might be, maybe 10% of the country. So my question is, what do we do about those people, that 1 in 100, or those refuseniks? Do we have to not worry about them any longer once everyone else has had the jab, or is there precautions we'll all still have to take for forevermore?
Well, the good news is those figures are really high. And the good news in the UK is that the take-up, especially amongst vulnerable groups, is incredibly high. So that means that we are going to be able to get a high degree of protection. But obviously, this is an ongoing challenge. You can't assume 100% effectiveness and 100% take up of the vaccine. And that's why it's important that we follow the data and we see the real world effect of the vaccine. It's not just about seeing it in the labs. It's about seeing it here in this country, the effect that it's having. So that is obviously vital and one of the things that we'll watch very, very closely. And we also need to watch closely the impact of the vaccine against different variants. Thankfully, there's very few of the variants that we are worried about from that front here, but we've got to keep it that way. So all of this is part of the challenge. Now, when you come to the long term, of course, there are other diseases like flu for which we vaccinate every year, updating the vaccine according to different variants, that in a bad year have an impact, but it doesn't require us all to put our lives on hold. And I think that we will wrestle COVID to the point where it is a disease like flu that we have to deal with, we have to live with. We can use vaccination to lift the greatest of the burden, but of course we always will need to take measures to protect the most vulnerable, as we do for flu every year.
Okay, let me move you on to something else. As a former culture secretary and digital minister before that, you're well steeped in the world of Facebook and regulations. Should the UK government be following Australia and now Canada in forcing Facebook to pay for news content it hosts?
Well, that is a very, very good question, Tom. And as a former culture secretary, I'll stress the word former and not step on my
Understood.
Successors'
But
toes.
you have views on this?
I do. I have very strong views on this, and all I can say is that I'm a great admirer of Australia and Canada.
Sounds like we should. We're dragging our feet, aren't we? We're not helping them.
Well, I think that this is a very important matter, and one that I've got no doubt the Culture Secretary will be looking at very closely.
And I'm sure he heard your words there too. Final question, and then I promise we'll let you go. You famously booked your summer holiday to Cornwall this year. Are you still going to go on it?
Well, I will follow the rules. I booked the holiday immediately after I went last year because we had such a lovely time, and I will follow the rules.
What does that mean?
It means you'll hear more from the Prime Minister on this and other matters tomorrow.
We wait with bated breath. Mr. Hancock, thank you for joining us this morning.
Thanks for having me on.